Whether you woke up with a kink in your neck or you suffered an injury in a car accident, our next guest take a personal approach to chiropractic care and muscular therapy and is ready to take care of you. Doctors Kelly and Adam Uri, they're here from MaxHealth Center. Gentlemen, great to have you.
Thank you.
Good to be here.
You brought your spine with you?
Got everything.
Everything's here. It's lovely. Like all the favorite flavors of sherbet you had there for me. Today we're talking about whiplash. I mean, this is something that, if anyone's been in an accident, you kind of get that little quick thing. It's not just accidents where that takes place, though, whiplash, right?
No, it happens all the time. In fact, I had a patient who just came in this week, and she had just walked, the modern staircases, the floating staircases, walked in, hit her head.
No.
Had significant signs of whiplash.
No way. So explain what whiplash is and the symptoms of whiplash.
So it's kind of like an overload on the spine. So as your neck stretches forward and backward, these ligaments that run up and down the back and front of the spine, they stretch. These are non-elastic. So once they stretch, they're stretched, and then your muscles have to work overtime to protect it. That's the long-term stuff with whiplash.
Interesting. And the symptoms, what will we start to feel when that happens?
Mostly pain.
Okay, fair.
But in addition to that, some people that get in the car crash variety of whiplash will have post-concussive symptoms because the brain moves inside the skull as your neck moves. So it might feel dizzy, nauseous, even focus can be a factor.
Yeah. So you're saying once this is stretched, it's stretched. So what do you do? How do you treat whiplash?
Well, you have to, so it's like a rubber band. I actually happen to have a rubber band.
Oh, there we go.
Here.
Always prepared. Yeah.
So when those ligaments get stretched and stretched and stretched, just like a rubber band, a lot of times, that rubber band won't go all the way back to tightness. So it takes rehab. It takes exercise. It takes, in our case as chiropractors, it takes some form of adjustment in order to get those ligaments to tighten up and make a solid state. No question.
Some people, they might get in an accident or they hit themselves or whatever it might be. They get it. They're just like, they'll tough it out. Is it one of those situations where the sooner you come in, the better when it comes to treating whiplash?
Always, and it's because of inflammation. Okay. Once you're inflamed, it's so hard to treat.
At least once a day we'll have a patient come in, and there'll be a new patient, they'll have neck or back pain or whatever, and they'll say, I don't know what happened, I just woke up. But then as we're going through the history, we find out you were in a crash like 5 years ago and you didn't do anything. And so that's so it is the sooner the better. So you don't have to hurt for 5 years.
Yeah, well, first of all, that, and the longer you wait, I'm assuming a little more of an uphill climb it will involve.
Yep.
So explain what the process is like. What are some of the exercises we do for whiplash?
Well, your body actually strengthens a lot on its own.
Okay.
So as we preserve motion, your body locks down. So these ligaments are loose, and so the muscles tighten.
Yeah.
And then your neck doesn't move, so you walk around like Frankenstein for a couple of days, or a couple of weeks, a couple of years.
Yeah.
And so you develop abnormal movement patterns. So as we break up those movement patterns and restore proper motion, your body strengthens a lot on its own. But there are some rehab exercises to do as well.
We have a before and after. This is your body on whiplash, and this is your body not on whiplash. The healthy and unhealthy spine. If we can put up that image, and we'll see the picture and the comparison. And go. There it is. Wow, there it is. Explain what we're seeing here.
So you can look at the healthy one. If you look in between each of the bones, there's great spacing. It's that kind of dark line you see. Yeah. Same with the other one. There's those dark lines, and there's space in between there. That's where the disc sits. But the difference is one's curving backwards, the healthy one. Yeah. The unhealthy is curving forward. That's because those ligaments they become lax. They become loose, and you start to lose that curve that you were born with, that you're supposed to have. And that can become an issue because then it puts abnormal pressure on the spine.
Yeah, of course. And then there's cervical degeneration as well. We'll have a photo of that coming up.
Okay.
And what is this?
That's like the long-term stage, the waiting for 5 years part. So you wait for enough time, and the bones just start to deteriorate. As your body stops moving, it degenerates.
And you actually have you brought a model. You have models for everything.
We have models for everything.
This is great.
So here's the exact same thing we were just looking at there. Here's the healthy end, and here's the unhealthy end. So as your body loses motion, it eats up all of these nutrient-rich things, the disc, and they start looking jaggedy like this. Also, the trauma themselves pull against the bone and create all these spurs, which is what arthritis is.
So the plan is to save it before it gets to that point.
You got it.
No question. Does insurance cover chiropractic?
Sure does.
It does? Excellent. Special offer, really quick.
We are going to do, because we talked about bones, and bones kind of tell the story of everything, we're going to give out 13 free x-rays.
Okay.
Just come in and let us know what the chief complaint is, and we want to take some x-rays so we can look at your bones and tell you your story.
Awesome. $300 value. You're getting that for free. Information's on your screen. Gentlemen, it's great to have you. Thank
Thanks,
you
Sean.
so much. No whiplash. JJ's dancing in the background now. It's really comfortable for everybody. MaxHealth Center has 3 locations throughout Las Vegas Valley. To learn more, call the number or visit the website on your screen. MaxHealth Center, a proud sponsor of the Morning Blend. The move she just did, I'm very certain she just had whiplash.